Hi there, I'm Dr. Kristina Tansavatdi, and in this video I'm going to be going over your consent for your upcoming fat transfer procedure. First thing I'd like to highlight is if you could pull up your consent, you're going to get a copy of the document. It should have been sent to you via email from one of our medical assistants. In that, just kind of follow along with me because it's helpful to know what I'm talking about. On the top of the consent, an informed consent is meant to give you information about your upcoming procedure so you're aware of what potential risk could happen, any complications that could be a possibility, or some things that are just common after the surgery that are just typical that definitely will be a process of the healing. So that could be bruising, swelling, pain, discomfort. Those are all typical of any type of surgery, including fat transfer. So about fat transfer itself, the procedure that I like to do is meant to put volume in areas where you've had volume loss. That being said, the main areas that I like to focus on are the upper face, so your temples, around the eyes, sometimes in the pre-jowl area, but primarily cheeks, temples, and around the eyes. If you are having that done with me, then the other things that you want to know is the alternative would be fillers. So that's an alternative to fat grafting. However, fillers are things that are injectables that are not long lasting. They are temporary. So that's one of the downsides of having an hyaluronic acid filler, Sculptra, or any of these other injectables on the market. Another alternative would be using implants. So that's like for the chin, you could use a chin implant, and the cheeks, cheek implants. The reason why I don't like cheek implants in the cheek is because it's very firm, and as we age, volume starts to descend in the face. So what happens is you can start to see the outline of the implant, as opposed to the chin, which is a different area of the body, and it's sitting right directly on the bone. This area of the chin doesn't really descend. The face descends into, so the cheeks descend into the lower face, and so that can highlight the cheek implant. Inherent risks of fat transfer procedure. So now specifically for fat transfer, I'm going to highlight general risks. Probably in a different video you can see this because typically I do fat transfer with another surgery, and the general risks will be highlighted there. But specifically to fat transfer, the first thing we want to talk about is the change in appearance. Sometimes patients get surprised with how much volume they get, and they think that that's going to be normal and that is going to be there permanently. I want to kind of lay your fears that we want to put in usually twice as much as we want to stay, and that's because the fat is transferred from another part of the body without any blood vessels, so it doesn't have its own blood supply. So when it's placed into another area of the body, your body has to build new blood supply to the fat so that it lives, and inevitably there's going to be some fat that will die or get resorbed by your body. So we typically, this is a prediction that about half of it will stay. So for that reason, your face will swell to where it's abnormally swollen or abnormally full, and it will slowly come down over the ensuing weeks. Typically by 6 weeks is when I envision that should be where we want the fat to stay. So that's a good hallmark or good basis of the measurement of where we want the fat to end up, okay? So you'll have to get through that first 1 to 2 weeks where you might find that the swelling is abnormal and you don't want to show yourself. Well, just know that's a normal process of the healing. Second thing is firmness and lumpiness. When people hear this, they think, okay, that happens to all of the patients. This is very rare. So the lumpiness that can happen is because the fat, if it's not processed well, and we just re-inject the fat, we just harvest the fat. If you've ever seen fat, like if you just have a piece of meat, right, and you get that fat around the muscle, you see it as a chunk, right? So it is thicker. It needs to be processed into finer particles, and that's what I do before I re-inject it. So the chance of getting lumpiness is very, very, very slim. The other part of it is important on the way it's injected. So the way I do the injection is I'm doing small injections every time I go in and out while I'm depositing the fat. So it's never going to be a bolus of fat. We don't ever want to inject a full amount with each injection. So for that reason, you might find if you're partly awake for the procedure, I'm moving a lot while I'm doing the injection, and that's normal, and we should not see any lumpiness. You may have it temporarily after the surgery due to swelling, but it is not a permanent thing, and we should not be seeing that. Under or overcorrection is also a possibility after fat grafting. We want to put about twice as much. Some people hold on to it better than others, and some might look great. More typical is that as the swelling goes away, most of my patients will say they want just a slight bit more. And so it's better to undercorrect than to overcorrect. So overcorrection, what we do to correct a problem with overcorrection is we have to go back in and we have to cut out the fat. And now we're putting another incision. So we try to avoid that as much as possible. So it's better to undercorrect, and if we need to go back and add more fat, that's okay. So I will tell you a percentage of patients who need to have additional fat is usually about 20%. So about 1 in 5 of my patients will need to get more fat. Next thing is asymmetry. Two sides of the face are not symmetric, and when we put in the fat, I typically call out the numbers and make sure that we have the same amount of fat on both sides. Unless there's some asymmetry to begin with, then I might go ahead and try to address the asymmetry by putting a little bit more volume on the one side where there's more volume loss. But again, this is not quite an exact science, and I can't tell you, yes, you're going to need 1.2 milliliters or how much volume. There's not an exact science on that. So in essence, there could still be that asymmetry if you already had facial asymmetry to begin with, and a lot of us already have facial asymmetry. That's a normal process. If you look at anybody's face, no two sides of the face are exactly alike. Next thing is long-term effects. The effects from facial fat grafting is going to last you longer than any fillers that you're ever going to have, but telling you exactly how long it will last, I can't give you an exact number. Some people age quickly and they lose the volume quickly in their face. Of course, fluctuating in your weight will also cause that fat to die off, so you want to maintain a stable weight. Those are the main things you want to know about fat grafting. But it will not last you forever, so I can't tell you that the fat is going to last you for the rest of your life. You are going to lose volume as you age. Tissue loss. This is talking about having any of the skin die or the fat die. It's very rare to have any of the fat or the surface skin necrose. I've never seen it, knock on wood, but it's very, very rare. Next thing here it's going to talk about, which we're going to skip, is fat transfer to the breasts, fat transfer to the buttock, which I do not do, and then fat transfer to the face, which is what I'm going to talk about, which is that when we address the face, the fat that we're putting in is living fat, and it can cause puffiness, it can cause bleeding in the area, it can cause potential infection. But other things that are very, very rare, and you'll see this in the literature, you might Google or whatever, is we talk about vision loss. That can be true with even hyaluronic acid fillers. Injection into a blood supply that then gets embolized to the brain, causing a stroke. Again, very scary. All these are uncommon, extremely, extremely rare. And if you've never heard of it, then that means you never heard of it because it's that rare. So this doesn't happen very often, and I have not had any of these serious complications. Most surgeons go through their whole career and never have these serious complications. So hopefully that allays your fears there. All right, then to combine procedures. So if you go to the next page, fat grafting is safely done with, most commonly, I like to do it with facelift surgery, but it can be done with eyelid surgery too. So sometimes under the eyes, I take out the fat that's there that's causing the eye bags. The eye bags can be not prominent enough to do anything with them. So if there's prominent bags, then I can use them and transpose them over the rim of the bone and fill in the area of the hollowing, what we call the tear trough. But if there's not enough, I usually then combine eyelid surgery with fat grafting, and these are all safe, okay? Seroma is the next thing on there. Seroma is very rare. So that's accumulating fluid under the skin, and that doesn't happen with fat grafting, or else I've never seen it in my cases. Donor sites. We do have to take the fat from somewhere else in the body. So what that means is you're going to have some bruising and swelling and maybe some tenderness at the site. Most common area is the belly area, but I could be taking it from the side of your legs or the inside of your legs, your thighs, or sometimes even the butt. Those are all common areas that I can take the fat from, and those areas might be tender. You could also have dimpling in those areas if the fat was, if we needed a lot of fat and it caused some irregularity under the skin, if you've already had dimpling or when I'm blanking out on the name, but suffice it to say, you can cause some dimpling in the areas where the fat has been harvested. So that's one downside for doing it. It doesn't happen very often, but I do have to talk about that. And then accidental intra-arterial injection. I mentioned that already previously about the fact that if it gets into the blood vessel and it goes somewhere else, it could cause a stroke, or it could cause a blood clot that then causes the skin to die off in the area where you've injected. Uncommon. Again, both of these very, very uncommon. And then again, it's repeating it again on the sheet about serious complications, which I've already touched base with you, which is fat embolism, stroke, infection, blindness, and then it will say even death. Again, all extremely, extremely rare. Blood clots can happen in any surgery. And so particularly with fat grafting, if you're not moving after the surgery, because I've harvested fat from another area of the body and that area is tender, you might not be moving around a lot. So it's just important to be moving after your surgery. Pulmonary complications are rare. That's just saying that the fat, if it embolizes to the lungs, for example, that can cause a pulmonary embolus, and that's extremely rare as well. Then we head over to general risks of surgery. This is going to be true for all types of surgery. We talk about healing as something that's unpredictable, and in every case, we do check your medical history and make sure that you're healthy for the surgery, but we can't predict how you're going to heal after the surgery. So that's one of the risks of the surgery. Second is bleeding. Bleeding can happen from any area where we've made a cut or we've harvested the blood, harvested the fat. I usually use your PRP, which is we take some blood that's harvested from you at the time of the surgery, and then we spin it and we take the platelet-rich plasma, which we process and re-inject with the fat, because it contains properties that help to stimulate new fat growth in the area where we've injected. So you may have a site of bruising and swelling or bleeding from the site where we've harvested the blood as well. And then there's infection, which is rare with this procedure. The face has a very good blood supply, and so infection is rare regardless of whether we're doing this procedure or any other procedure in the face. Ileus is constipation. If you're not moving around quickly after surgery and you take any narcotics, it can slow down your gut and you can get constipation. So please be moving. Scarring is rare with this procedure because we're making very small incisions. So with a facelift, I might be making larger incisions, but for fat grafting, as I said, there's puncture sites. So the puncture sites really heal up very nicely in the face, and in the body, there might be a very tiny puncture incision as well. So those heal up very nicely. Firmness is where the areas where we've injected can feel firm to the touch, and that's due to the swelling. So that's all very normal. Skin sensitivity, the area where we've injected might feel numb to the touch, but as the skin wakes up and the numbness goes away, it might feel tingly or might feel itchy, and that's all normal. Major wound separation. The wounds could separate, but with fat grafting, not very common, because again, we're not having big incisions, we're not stretching or pulling on the skin. Sutures that I use are all on the surface, so you should not have any deep sutures. You should not have any problems with the suture reacting, because those sutures are taken out pretty quickly within a week. Delayed healing is a possibility with any surgery. Revision surgery has to do with the fact that we might have to revise, meaning adding more fat, which, as I said again, is about 20% of the time. So that should be in the back of your mind that we may need a second procedure, which is not very common, but it is more common than anything else I've discussed. And then damage to deeper structures, we talk about the lymphatic drainage pathway can be disrupted when we put fat grafts around the area in your face. It's usually in the same path where the lymphatic pathway drains the swelling in your face. That's why moving right after surgery is important to get the lymphatic system to flow. And then surgical anesthesia involves its own risks, so general anesthetic, the anesthesiologist will go over that with you on the day of the procedure. If you have local anesthesia, anytime you've got a local anesthetic, there is a very rare chance of having an allergic reaction to the local anesthetic. And then shock is rare as well. I've never had a patient go into shock after surgery. Having this procedure is short. It's not a lengthy procedure on the body, so you should be able to go through this without that. And then pain. Every one of my patients experiences discomfort, but not intense pain. So with fat grafting particularly, it's like we've had injectable of hyaluronic acid filler. It's putting volume in, so there might be discomfort, there's stretching of the skin, but there's not extreme pain, and chronic pain is very rare. Cardiac and pulmonary complications, we've already should have gone through your medical clearance, but this is still a possibility with any surgery, and that is the risk of having a heart attack or a pulmonary infection, or having an embolus, which is a clot that gets thrown off into the lung area that can cause breathing issues. Venous clot or thrombosis is if you're not moving around after surgery, a deep vein clot can form because you're not moving your legs, and that clot then can be thrown up to your lungs. That's again very rare as long as you're moving after surgery. And then allergic reactions and drug reactions. These are just, you could develop allergic reaction to tape we apply. It might be the suture material, or it could be with any medication we provide. These are all possibilities, and if it were to happen, we stop the medication, or in the case of whatever we're putting on the surface, then we remove that product. Okay. Next page is going to talk about surgical wetting solutions. So for this is true with fat grafting, is I use dilute local anesthetic in the area where I'm harvesting the fat. And it's not ever in a large enough volume to cause problems, but it will say that if you have a lot of fluid, it can cause systemic problems. It doesn't ever happen in what I do because we're not utilizing that much fat, so we're not needing to put lots of volume in those areas. So this is not something you need to be worrying about. Fat air embolism is a possibility, and as I mentioned earlier when we talked about serious complications, it's very rare, so extremely rare, but the fat could embolize to another area if we've harvested and we've injected it. Then when we inject it, it could possibly go to another site where we don't want it to go if it gets into the blood vessel, which again is extremely rare. Persistent swelling is lymphedema. That means the areas where we've injected will stay swollen for a longer period of time, and that can happen because we have great lymphatic supply in the face, and it can get disrupted from the procedure. An unsatisfactory result is always a possibility with any type of surgery. There's no guarantee about what the outcome's going to look like. We can have, with all the procedures, this is sort of it's an art form rather than a science. Of everything I do, this is the most artwork because it's a guess of how much, through experience, how much fat you need in certain areas, how much is going to stay, what I predict to stay, because oftentimes then if we need to, we're going to do a little touch-up later, but we don't want to overdo it. So that's a potential with this procedure, and so you should have that expectation in the back of your mind, and hopefully you're one of the 4 out of the 5 that doesn't need any second procedure. Additional advisories, so medications and herbs, we're going to go over that with you when you come in for your preoperative appointment, and that's what medications you can continue, and then what herbs or supplements you have to stop. Sun exposure, direct or tanning salon, of course not going out in the sun before or after your surgery. After surgery by a month, because we don't want to expose the areas where we've injected to the sun. You could cause post-inflammatory hyperpigmentation, which means the spots that we injected from, they could look dark. Travel plans, you're also not going to travel anywhere far for the first 2 weeks after surgery because of the risk of a DVT, which is a deep vein thrombosis. Long-term results, we expect this to last you a good long time, but again, we can't predict how long that fat's going to stay, and particularly if you go up and down with your weight, if you are not stable with your weight, that will cause the fat to be lost. Interference with sentinel lymph node mapping, this doesn't truly apply with what I'm doing, but breast surgery is what this connotates to, so you can probably skip this part. Body piercing, if you have any jewelry on your body or your ears or anywhere else on the body, you want to remove it before your surgery, because we use electrocautery, which is electrical current, to stop any areas of bleeding, and so you'll want to make sure you don't have any jewelry on you. Nails, you'll want your nails to be, like mine, clean, dry, no nail polish, so that we can put the oxygen sensor and pick up the oxygen supply in your blood. And then a future pregnancy and breastfeeding, you'll want to let us know if you're planning to get pregnant, because that can have an effect on your outcome as well as your recovery process after fat grafting. Female patient information, if you're on any birth control pills or if you're on estrogen replacement, you'll need to let us know, because that does increase your risk of developing a DVT. Intimate relations after surgery, so no sex. I know people balk at this. No sex for 2 weeks after surgery, because sex is an activity and it will increase your blood pressure, increase your heart rate, and that can have an effect on your recovery. Mental health disorders and elective surgery. It's important that you have realistic expectations. If you passed it to the point where you've seen us in our preoperative appointment, that means we think that you have realistic expectations, but please keep in mind that whatever is being done, it is surgery, and surgery is not an exact science, particularly with fat grafting. So you may not be completely happy right off the bat, but as I said, as time goes on and the swelling goes away, you'll get more and more happy with the outcome from fat grafting procedure, but I can't guarantee any of these results. Additional surgery may be necessary. So when you look at the consent, it talks about how there's reoperation as a possibility with any surgery, but particularly with fat grafting, as I talked about earlier, because the fat will necrose and die, and I'm giving a guesstimate of how much fat stays. That's the reason why this particular procedure has the highest rate of having to do a reoperation, and as we said, it's about 20%. Patient compliance, it's important that you follow all of the instructions that we've laid out in the post-operative instructions, because it's essential to the success of your outcome. And that means coming to all of your post-operative appointments, because we have to be able to assess and go over what things need to be done or not done after the surgery to ensure the success of your procedure. Attestations, you're going to fill this out when you come in for your for your preoperative appointment, and that is, are you a smoker? Because that can have an effect on your recovery. Whether you have any history of sleep apnea and any of the symptoms for sleep apnea. DVT and PE risks, which we'll go over with you when you come in. And if you have any family history, we definitely want to know about that ahead of time. And then the ways to avoid getting a DVT are walking as soon as you can and using the compression devices that you go home with. So when you leave the surgical center, they'll send you home with some compression devices. You want to use that when you're sleeping in bed. The last part of the consent we'll go over together at your preoperative appointment, and the last page is going to outline the same things that we've talked about already, and we're going to sign that last page with you. All right, so that is the entire consent for fat grafting. If you do have any questions from watching this video, please write them down so you're ready to bring them to me at your preoperative appointment. Thank you for tuning in.